So August is over, September is here. I'm hoping for some fall weather, as I'm sure you are, but it is amazing how fast this summer went. And I would love to be talking about anything right now besides COVID, but here we are again. We've seen the transmission rate, which is supposed to be under 1, significantly over 1 for the last month. We've seen our cases internally going up. Certainly our testing of our own employees, as well as the demand for testing, is increased everywhere. You know, this is the start of flu season. We've seen respiratory viruses going through children, and we know that often then leads to viruses within adults. But our transmission rate around our kids continues to be very high. And that's so concerning, because we know that our children under age 12 don't have access to the vaccine yet. But here's some of the great stuff that we do know. We do know that Pfizer's study for the kids from 5 to 12 is just about finished the research, and that they hope to submit in September. So hopefully that will give us an early opportunity to get that information approved, and therefore kids will, between 5 and 12, will have access. And obviously, as kids are going back to school, that's of primary concern to parents. Secondly, we know if you are immunocompromised, these are the conditions that appear on the screen that you are eligible today to come to our Mullica Hill or Vineland sites and go ahead and get that third dose. That makes sure that you are absolutely protected. For those of you who are so anxious to get that third dose, including many of our Inspira employees who are healthcare workers who got their doses early, and the guidance has been that you get it 8 months following your second dose. So many of us are in that window right now. That as of September 20th, we anticipate that we'll be told that those third doses will be available and then readily available. And again, they've encouraged us to make sure that you stay dose for dose where you got the other first two. Lots of information coming, lots of changes. I know it's very confusing, but we're going to do our best just to keep you as apprised as possible. And here's what I need to tell you. Our COVID patients still remain a smaller percentage than our patients that are higher acuity. The COVID patients that we have in the hospitals are folks primarily that have not been vaccinated. That's just a fact. The higher acuity patients that we're seeing, non-COVID, are people who are delaying care. They just didn't want to come back to the doctor, or it was hard to get in, or, please, if you have any symptoms at all that give you any concern, please make sure that you get to your primary care doctor. If you can't get your primary care doctor, use one of the urgent care facilities or come into the ER. Whatever it is, we just don't want you to delay, because we've seen too many delays end up in situations that are just tragic. And we know that we can prevent these things if we can help you. I've been talking over and over again with you and sharing just the tremendous gifts that we have and the talented staff, and how they just have given their all to Inspira. And one of the people at the top of those lists is Tina Robinson. And if you have gotten your shot at Mullica Hill, then chances are Tina was there. Tina is just giving her all to make sure people are safe and they are vaccinated. And on the way home from a recent trip, Tina was on the highway. And sure enough, she actually saw real time a car sitting on the side of the road that had been broken down, and a car swerving. And that car was swerving, hit that stopped car. As soon as they hit, Tina safely parked her car, went running to the scene. She's obviously a trained nurse, ER nurse, EMS trained, and she was first on the scene. So until the squad could get there, she was actually already on the scene providing compression and doing all the things that she could possibly do. This just shows you how what I'm saying actually has validity in times that aren't scripted and just real life. We're there for you. In tragedy, or in trying to prevent conditions, or if you get sick. Whatever it is, we want to walk this healthcare journey with you. This is not just about when you come in for care, but we're part of this community. We live here. It is being a trusted partner that allows you to let us in this way. And Inspira is a better organization for having earned some of that trust. And I just want to affirm to you that we continue to work at that every single day. Until we meet again, be well and stay safe.